All right. So this is the first slide in our slide deck, and welcome to the shoulder and rotator cuff pain workshop. And the point of this workshop, as well as all the workshops we do, is we're trying to teach people how to get back to normal naturally and avoid the use of medications or getting injections or having surgery that they don't need or that you don't need. My name's Christy Pasquale, and I'm a physical therapist, and I'm presenting, and Katie Peterson is another physical therapist, and she's the one that's on in the background kind of helping us out. I'm primarily in the Colchester office. Katie works mainly over in our Hebron office. We're 2 of the 8 physical therapists that work here. And just to give you a little bit of background, we've been around for 30 years. Our first office was in 1989 in Colchester, our second office 1990 in Hebron, and we've been around all that time. I'm fond of telling everybody that over the last 30 years, we've done 250,000 treatments on people. So if there's 15,000 people or so that live in Colchester, 10,000 people or so that live in Hebron, we like to say, if you do the math, that we've treated everybody that lives in Hebron and Colchester at least 10 times. So let's get to the worksheet now, and we're going to talk about what the rotator cuff is, because the rotator cuff is really what causes most shoulder pain. So what is the rotator cuff? And it's a group of how many muscles that blank the shoulder. So the rotator cuff is really a group of 4 muscles, and those muscles move your shoulder, whether you're moving your shoulder up to the front, moving your arm up to the side, or reaching behind your back. Those rotator cuff muscles are active during all of those movements. And there are really, first I want to point out that your shoulder joint is kind of a ball and socket joint, which is one of the next questions we're going to answer. And the rotator cuff muscles all start on your shoulder blade. This is a back view of your shoulder blade. And what I want you to notice is that there's a space here that the rotator cuff muscles all go through. So on the slide off to the right, it shows 3 of the 4 rotator cuff muscles. 2 of them start kind of on the back of your shoulder blade and wrap around the back to attach to your arm bone, and you can see they go right underneath that piece of bone. One of them starts up on top, goes through a tunnel, and then attaches to the top of your arm bone up there. So this is kind of the back of the rotator cuff. And the rotator cuff is really the tendons, or the white part right in here. So on the next slide, this is a front view, and this shows the 4th muscle that's part of the rotator cuff. This muscle starts on the inside of your shoulder blade, kind of goes through your armpit and attaches to the front of your upper arm bone right there. Here you can see the part of the rotator cuff that comes off the top of the shoulder blade, that goes through that tunnel and attaches there. And then the other rotator cuff muscles would attach around the back here. And the big deal about this overhanging arch of bone and the muscle that comes over the top, the muscles that go around the back, as well as the one that comes through the front, is those muscles can get pinched or impinged right in here, so that when you raise your arm up over your head, it causes pain, or up to the side, it can cause pain, or even reaching behind you. And that's the reason people get pain when they're sleeping, with either their arms over their head on their back, or if you're lying on your stomach with your arms over your head, you're causing your rotator cuff to be impinged. So as we've talked about, this is a front view of your shoulder, and the shoulder is a ball and socket joint. There is the ball, and it's kind of sitting on a shallow socket. The good thing about it is it allows your shoulder to move a lot, and the bad thing about it is it allows that impingement to happen. So if we go to the next slide, the point of this is to reinforce how unstable your shoulder joint is, which allows your shoulder blade to get pinched a lot. Across the top is where that piece of bone would be hanging off. Right here is one of the points on the shoulder blade. Your shoulder blade is like a triangle. It's got a side there that goes down, up, and across. The take-home message is that if your rotator cuff gets pinched between the ball here the muscle goes through the space, and then there's an overhanging piece of bone here, then you end up with an impingement. So the next slide, I know this is a pretty ugly slide. It looks like somebody threw spaghetti at a skeleton, but in this slide, we're going to talk about the 4 areas that need to work together for your shoulder to move normally so that you don't have a shoulder impingement or shoulder pain or some other shoulder problem. And the first area, if you're following along, well, let me back up a little bit. So first we did 1A. What is the rotator cuff? It is a group of 4 muscles that move the shoulder. If you're following along on the worksheet, 1B, the shoulder is a ball and socket joint. And now we're working on 1C, the 4 areas for a normal shoulder, or the 4 areas that need to work normally so that you have a normal shoulder. So the first area that needs to work normally is actually your neck. So the answer for that blank would be neck. And the biggest area or that we see issues is people end up with pinched nerves, which is why I'm trying to make that point with the slide. In this little space here, there's normally a disc. It's just the way this picture is set up. And as time goes on, our discs collapse. It's a normal part of aging, and you end up with pinched nerves. And of course, that can cause neck pain, which sometimes is a component of a shoulder problem. But just the pinching on the nerves supply the muscles that cause your rotator cuff to move. And if those muscles aren't getting a normal signal, you're not having normal movement of the rotator cuff. And then you end up getting an impingement because the rotator cuff is really what controls the spinning and the gliding of that ball in the socket. If one of the muscles isn't getting the nerve supply it's supposed to get, it's not getting the proper directions, so the ball slides in the wrong direction and the rotator cuff will get pinched, causing one of those impingements. So the first area is the neck, and it can be because you have a collapsed disc. It can be because the muscles along the side of your neck are in spasm and pinching the nerves. There's lots of different reasons. And one of the keys to getting your shoulder taken care of if you're having shoulder pain, or one of the keys to preventing shoulder pain, is to make sure that you have good posture and you prevent neck problems. So the other 3 areas that need to move normally or work together normally for your shoulder to move normally include your collarbone right here. And your collarbone is right across the front here. And if you put your hand on your collarbone and you raise your shoulder up to the side, you'll feel your collarbone spinning around. Or if you raise your arm up to the front, you'll feel your collarbone spinning around. Now, it doesn't move a lot, but your collarbone sits on top of your shoulder blade over here. And although you can't see it clearly in this picture, it sits against your sternum or breastbone on the other side. If the joint towards the middle isn't moving properly, or the joint out to the side isn't moving properly, that's going to restrict things as you go to raise your arm up over your head. So your shoulder blade is going to stop sliding, your collarbone isn't going to rotate, and what ends up happening is the muscle gets pinched in here between the ball and the socket. Now, just like the collarbone moving, the other thing that moves when you raise your arm up over your head is your shoulder blade. As you lift your arm either up to the front or up to the side, only about 2/3 of that motion happens between the ball and the socket. The other third of that movement happens because your shoulder blade actually spins. So your shoulder blade has to move up, whether you're going to the front or you're going to the side. If your shoulder blade doesn't move, eventually the ball and socket run out of movement and you end up with an impingement, or that rotator cuff muscle, whether it's the one over the top, across the front, or the 2 that go around the back, those muscles end up getting pinched and causing shoulder pain. Or if it happens for a long enough period of time, you actually can get a tear of your rotator cuff. So the first area that needs to work properly is your neck. The second one's your collarbone. The third one is your shoulder blade, and the fourth one is actually your ribs. So it's not that your ribs do move, and what most people lose track of is their first rib is really up high, right at the base of their neck. So if you put your hand on your collarbone and you push straight back and then push straight down, the hard thing you feel right there is your first rib. And if you take a deep breath and let it out, you'll feel your rib go up and down. And in some people, for a variety of reasons, because they have a neck problem or other reasons, the rib doesn't move properly, the rib can get stuck up or the rib can get stuck down, and it's the first rib, as well as the second rib or the other ribs. And if that happens, it prevents your shoulder blade from riding properly on your back. When your shoulder blade stops moving properly, your arm bone is going to kind of run, or the ball on the socket runs out of real estate, and you end up getting an impingement up there in between your shoulder. So the fourth area that needs to work properly in order for your shoulder to move in a healthy way and not end up with an impingement and pain is for all four of those areas to move. So here, if you're following along on the worksheet, there's the answer to the questions. We're about 15 minutes into the presentation. I'm hoping it's over within 45 minutes. So at this point, I think we've gotten through a lot of the details of it. So we're going to move on to how it is that our office specializes in shoulder and rotator cuff pain. Now, it's the shoulder along with the neck and back are the top three things that we treat in this office. And it just so happens that, the shoulder and the neck are closely related. And we really have started to specialize in treating the shoulder and rotator cuff over the past 5 years or so because of the studies that have come out to show that conservative care is just as good as surgical care in the treatment of shoulder pain or rotator cuff problems. They've done studies where they've compared sham surgery to real surgery, and basically they're not tricking the people in the study. Everybody knows that they're in the study. So you might take they took 200 people, 100 of the people they did the real surgery to, they put the scope in, made the holes, went inside the shoulder joint and did the surgery where they trimmed things up, cleaned things out, and sewed people back up. Another 100 of the 200 people, they just made the holes and didn't do any of the surgery. They did look around, and then they sewed the people up. They sent everybody to physical therapy, and it turns out that 6 weeks later, there was no difference between groups, the people that really had the surgery or the people that didn't have the surgery. So as a result of studies like that, we've come to realize, and we've started stressing to the public, that you can really do just as well without the risk, the time, and the expense of having shoulder surgery. And we've done the same thing with a number of other areas. The same thing is now true for the neck and the back. Studies show that conservative care is just as effective as surgical care, or a lot of times injections or medications. And we're going to talk about some of the dangers of injections and medications in a few minutes. But that's how it is that we specialize in the shoulder and rotator cuff pain. We do the same thing with the knee and the hip. And we've started to do the same thing with hand pain and carpal tunnel, because it turns out the conservative care is just as effective as surgical care or other medical care for most people. And we don't have the same risks and side effects as that other treatment. All right, so let's get back to talking about your shoulder pain. So when we meet with somebody that has a shoulder problem, we're looking to see if there are things that cause your pain, or is your pain reproducible? So a lot of people tell us that they have pain when they sleep at night. A lot of times they can't sleep on the painful side, but they can sleep on the good side. A lot of people have pain when they're reaching up overhead to put something in a cabinet. People complain of pain when their arms are up driving, or when you're sitting at a computer keyboard, especially this day and age with everybody working from home. So we want to know if your pain's reproducible, and if you're following along on the worksheet, that's the next blank to fill in. And basically, because if you have reproducible pain, you usually your pain is most likely reducible. And we always think it's pretty amusing that reducible is reproducible, just taking the pro out, and then you get reducible. But basically, that means that if you avoid doing certain things, your pain goes away. And we like to ask people in the last 30 days what their worst pain was. Because if your pain is a 10 out of 10, that's usually not a good sign. If your pain never gets better and it just stays at a 10 all the time, a lot of times when we get you in, we're gonna end up referring you out to have some medical tests that if you had come in and gotten it taken care of earlier, you wouldn't have got to that point. And we'll talk about that in a minute. But what you should start keeping track of, if your shoulder's bothering you and you're thinking of doing something about it, is what your pain level is when you're not doing anything, and what your pain level is when you're doing things that cause it to hurt. Keep track of what those things are that cause it to hurt and what the pain level is at that point, and that'll help whoever you go to get it taken care of figure out what the problem is. And if they're not asking you what's your pain level and what are you doing, then that might be a sign that they're just trying to get you to do surgery or something else and skip the conservative care step that can really be helpful to everybody. All right, anybody have any questions? You can kind of pop them into the chat as we go along. At the end, sorry about that. I'm going in the wrong direction with my slides. There we go. So if you have any questions that we're going to try to answer questions at the end, you can type them into the Q&A, or as we're going along, if you have something that Katie'd like, you can have Katie address, just type it in the chat box, and then Katie will either direct it to the Q&A at the end or handle it directly with you. So does anybody have any questions at this point that I'm not being clear about? If you could just type them in, that would be great. All right, so now I'll move on to the next slide for real. All right. So whenever somebody has a problem in life, including shoulder pain, there are really just a few things that you can do. And the single biggest mistake that people that have shoulder pain, as well as any problem, make is that they ignore it. And ignoring it usually sounds like an excuse. My shoulder hurts because I pick heavy things up and put them down all day. My shoulder hurts because I have arthritis. I have arthritis because my mother had arthritis. There's lots of different reasons that your shoulder can hurt, but making an excuse isn't going to make it go away. And ultimately, you're going to end up with pain as a 10 out of 10. So that's not something we recommend that you do. And we assume that you're here because you want to try to do something about it. So the next thing that people can do when they're in pain is they can alter or mask the pain. And altering or masking the pain in healthcare usually involves medications or getting injections. Now, the one thing I do like to talk about during a presentation like this is the danger of taking medications, because over-the-counter pain medications like Advil or Aleve have a really bad side effect. And I was surprised by this. Every month we send out newsletters to physicians that refer patients to us. And in researching that, I was really shocked to find out that 3 out of every 1,000 people that take those types of medications, Advil or Aleve, on a regular basis, worldwide end up dying every year. And it has to generally do with bleeding ulcers and the side effects of the bleeding ulcers. So we really recommend that you avoid taking those medications. And really all those medications do is they block the inflammation from the impingement. If you have an impingement, you get inflammation. The inflammation causes pain. If you take the medications, it gets rid of the inflammation and the pain. You start moving your shoulder again, and you start impinging again. And the problem is that you really haven't taken care of the problem. If you take care of the problem, the impingement's going to stop happening and you're going to get back to being able to do whatever you want without having shoulder pain. Now, injections do the same thing. A lot of people get cortisone injections into their shoulder, and the problem with a cortisone injection is that it knocks the inflammation out. It certainly gets rid of your shoulder pain, and sometimes that's okay to do once just to knock it out if it's really, really bad. But the problem with getting shoulder injections on is that you're not fixing the problem. You're temporarily getting rid of the inflammation, you get rid of the pain, you start moving your shoulder, you end up with the same problem. Either your rib is out of place, there's a problem in your neck, your collarbone isn't moving properly, or your shoulder blade isn't moving properly, and that's why you end up having ongoing shoulder pain. All right, so the last thing you can do when you have a problem is you can handle it. And hopefully that's, for those of you that have shoulder pain, that's why you're here. And I know some of you said that you were trying to be proactive. But what I like to talk about is the importance of avoiding some of the traps. And the traps really have to do with things like x-rays or MRIs. This is an x-ray and this is an MRI. And the trap has to do with normal changes. If you did an x-ray or if you do an MRI of a 50-year-old, the average 50-year-old is going to have a problem. And I'm talking about if you took 150-year-olds that don't have shoulder pain and you did an x-ray or you did an MRI, at least 50%, and in some studies more than that, are going to have arthritis, degeneration, or they're going to have some sort of a rotator cuff that's visible, but these are people without shoulder pain. So if you have shoulder pain and you get an x-ray or an MRI and you see something and there's something on it, it's logical to think that that's what's causing the pain. But unfortunately, a lot of people end up going on to have surgery or medications or injections, and the pain doesn't go away. And the pain doesn't go away because you really haven't fixed the underlying problem. The underlying problem being a pinched nerve in your neck, either because you have collapsed discs in your neck, the nerves are getting pinched between the muscles. You might have a rib that's out of place that's preventing your shoulder blade from moving properly. Your shoulder blade may not be moving properly because your muscles are weak. Your shoulder blade might be getting hung up because your collarbone isn't moving properly. There's a whole series of things that should be looked at before you have an x-ray or an MRI, because the x-ray or MRI on the average person is going to find something wrong, and on the average person, it really doesn't match up with the pain. We know that because we see people that have had surgery, they don't get better after surgery, they go to therapy somewhere else and rehab somewhere else, they end up coming into our office and we work on their neck and we work on their ribs, and all of a sudden their shoulder pain goes away. And it's because their shoulder pain wasn't being caused by what they had surgery on. It was because the surgery didn't address the underlying problem. And I'm not trying to beat up on orthopedic surgeons. There's lots of great orthopedic surgeons out there. Most of them aren't running right to surgery anymore. It's just that they're trained to fix everything with surgery, whereas physical therapists tend to without surgery, with natural methods, so that you can avoid medications, injections, and surgery. So I'll get off my soapbox and we'll move along a little bit. All right, so if you're following along on the worksheet, those are the answers filled in. The number one single biggest mistake shoulder pain sufferers make is that they ignore it. And there are three things that you can do when you have shoulder pain or any problem in life. The first one is ignore it. The second one is mask it or alter it, and that's medications or injections. Or the third one is that you can handle it. And again, if you handle it, we just want you to avoid the landmines. Don't go right for an x-ray. Don't go right for an MRI. Don't fall for the advertising that says, how can you treat it if you can't fix it? Because it's really not true, because you're going to end up, if you have an x-ray or an MRI, the average 50-year-old ends up having a procedure that they may very well not have needed. All right, enough said about that. All right, so I have about 12:30, so I'm moving along a little quicker than when we do these workshops in person. This is our first online workshop that we're doing because of the COVID-19 virus. Although our offices are open and seeing patients, it's probably not prudent, and it wouldn't be following guidelines if we were running workshops in the office, and naturally we wouldn't think many people would come in anyway. It's nice to do an online workshop because at least I get to take my mask off. During the day here, we're all working around with masks, but I'm able to shut myself in a room so that I can do this workshop for you. All right, so the most common causes of shoulder pain are, and again, this is number 5 on your worksheet if you're following along on your worksheet, a problem in the neck. And we've talked about that in the neck. Well, we've talked about 2 of the problems in the neck. Usually there's a collapsed disc causing a nerve to be pinched, or the muscles along the side of the neck can be in spasm, causing a nerve to be pinched. And I know that this is the last thing on the slide down here on the bottom is posture, but when we're talking about the shoulder, neck posture is a major problem. And one really good way to demonstrate that is if everybody would stand up and sit up as straight as you can. Now, I can't see you, so hopefully you're all doing that. But stand up or sit up as straight as you can, and then raise your arms up over your head and see how freely that is. If you have a bad shoulder, you might want to leave that one out and just do your good shoulder and see how good it moves. And then I want everybody to slouch as far forward as you can. We just were in good posture and raised your good arm up and saw how it felt. Now you're going to slouch as far as you can and then raise your arms up over your head, and you should feel a lot of tightness. And that tightness is essentially an impingement. When you're in bad posture and your head's forward and you raise your arm up like that, you're pinching the rotator cuff muscle in between the ball and the socket, which is kind of that tightness you can feel. So when we're talking about a problem in your neck, it's often posture, and pretty much anytime you get your shoulder treated, they should be addressing your posture. Impingement, we've talked about a lot. That's actually what we're stressing in this webinar. And impingement basically happens because something's not moving correctly in your shoulder. Your rotator cuff tendons, where the muscles attached to the ball, are getting caught between the ball and the bone over the top, and it's causing an impingement to happen, which causes inflammation and causes pain. All right, I think we're in the home stretch here. So what does successful, non-invasive, natural treatment look like? And you can see the answers there. And it's basically, the first one is hands-on therapy to move the shoulder and the surrounding joints. You can't have good posture if the middle of your back is stiff. A lot of times when we're treating shoulder patients, we end up working on their low back, and we even end up working on their core muscles or abdominal muscles, so that you can hold good posture. You need adequate flexibility and joint mobility in your mid-back and your low back, and adequate strength in your abdominal muscles, as well as flexibility in your neck in order to have good posture. Now, we certainly would work with you to teach you stuff that you can do on your own at home, as one of the emphasis is of what you do for flexibility issues or posture issues. But we also find that it's the hands-on care where we're manipulating your neck and your mid-back and low back to help get things moving. So we also do a lot of stretching exercises, which I don't have a picture of, but here's a specific strengthening exercise that's designed to work on that muscle that goes right over the top of the shoulder. It's an exercise that has to be done properly so that you don't cause an impingement, and you need to be ready to do it to make sure that you don't make your impingement worse. So some of the other things that we do for treatment here, this slide over here is showing a class 4 laser. Class 4 lasers are not in wide use in practice these days, especially for lots of musculoskeletal areas. We're one of the few people east of the river in Connecticut, and one of the few people in Connecticut that has a class 4 laser. A class 4 laser is a high-powered laser. Lasers have been around for use in clinical treatment for a while, but not the power in a class 4 laser. We can do in 5 minutes what it would take 8 hours to do with the lasers that are commonly in clinical practice. In the Colchester office, we have a 25-watt laser, and over in the Hebron office, we have a 40-watt laser. That's opposed to the more common class 3 lasers that end up at a half a watt. And it takes a really long time to get an adequate clinical treatment in that's going to have effects on the tissue that are going to promote healing that it would take to get with a class 3 laser. And then this slide over here, this is just demonstrating trigger point dry needling. We use the same style needle that's used in acupuncture, and we use that to relieve trigger points so that you're able to get rid of the pain, and it allows us to get your shoulder moving quickly without exposing you to medications or injections. And it's the same reason we'd recommend the laser. The laser is very safe and there are no side effects to it. And trigger point dry needling is very safe as well, and you don't have the side effects or issues that you have with medications, injections, or surgery. So what we're offering everybody that's come to this workshop is a discovery visit. Now, a discovery visit can be done either online at this point if you're not comfortable going out, or if you have some of the conditions that, medical conditions that it's recommended that you really stay in for, we can do a discovery visit online. So the discovery visits are available in the office or online, and they're available in either the Hebron office or the Colchester office. On the bottom of the worksheet that was emailed to you, this website link is listed. If you go to that website and fill out this form, and on the bottom of the form, there's a black register button that got cut off on the slide, it looks like. So you fill in the form, you click the register button, and somebody from the office will give you a call, and we'll schedule you for either an online or in the office discovery visit. Even if you just have questions about your shoulder or about exercises that you want to do, we're happy to do a discovery visit with you and go over whatever questions or issues you might have. Also on the bottom of the sheet, there's a listing for our website, pptsm.com. And if you're interested in seeing some rotator cuff or shoulder exercises, if you go to our homepage, in the top right-hand corner, there's a red YouTube button. If you click on the YouTube button, and there's a bunch of different exercise lists there, and the standard rotator cuff exercises using resistance bands. There's a whole playlist of them that you may want to go through. The problem is that for many people with a shoulder problem, just doing the simple rotator cuff exercises aren't enough. There is a small subset of people that just doing the resistance band rotator cuff exercises is enough. So we always do recommend that people feel free to try those first. I just need a sip of water. All right. So I think we have one more slide. We do, and that's the question slide. So if anybody has any questions, if you could type them into the box, that would be great. It doesn't look like anybody has any questions. Common questions that do come up when people come to these workshops. We've probably done 40 workshops since November of 2018. The majority of them we've probably done about 15 on back pain, 15 on shoulder pain, and then 10 have been kind of on knee pain, hip pain, hand pain, and carpal tunnel issues. And most people tend to have questions regarding if they need a referral to come to physical therapy, and you don't, you can come to physical therapy without a referral. And if you're running your treatment through your insurance, most insurance covers it the same as they would if you went to your doctor and got a referral from a doctor or a nurse practitioner or whoever your regular medical provider is. But the bottom line is you don't need a referral, and insurance does cover it. In this day and age, many insurance companies will require people to go to physical therapy before they'll even cover an MRI, although that's not true of x-rays. You can pretty much go anywhere and get an x-ray. So those are usually the two main questions people have about physical therapy.